Hello, my name is Lauren Brown. I'm a doctor of traditional Chinese medicine. I'm a clinical director of AccuBalance Wellness Center in Vancouver, BC, and chair of the Integrative Fertility Symposium. And I'm getting to chat with Dr. Rebecca Genuis from near the Edmonton area, Alberta in Canada. Now, Rebecca, you had published a paper on preconception care, and there was a good chunk in there on vitamin D, which it's one of the vitamins that most of my patients are on, and we actually do regular testing of our patients for vitamin D. Can you share about your paper on preconception and that section on vitamin D, and then I'll see if I have other questions for you.
Yeah, totally. So I published a paper on with one other author, but about the importance of preconception care. So preparing a woman's body, and I'd also like to add a man's body, for conception in order to optimize the outcomes of the pregnancy and the child's health after they're born. So, we went through a bunch of different factors, nutritional factors, toxicological factors, all these different things. But within the nutritional factors, we honed in, we had this long table on just vitamin D and pregnancy and outcomes, because there's an unbelievable number of papers that have studied just the effect of either not having enough vitamin D or the benefits of having enough vitamin D on pregnancy and on the child afterwards. So, it's been associated with all kinds of things in pregnancy, things like preterm birth, afterwards, postpartum depression associated with not enough vitamin D. And then in children, we've seen all kinds of associations. The paper is a few years old, but things like asthma, bone health, even. I think there's stuff about children's IQ, all just associated with mom having enough vitamin D in pregnancy and going into pregnancy. And this is a cheap supplement. It's not hard to get. If you're fortunate enough to live somewhere sunny, which I'm not most of the year, then, you just spend some time outside, and most people can convert their vitamin D well enough that way. But if not, cheap supplement to take, and the benefits are just through the roof.
And do you, with your patients, will you test them, or you just have a general take this amount, or do you like to test their vitamin D levels?
Yeah, so I would love to test all my patients' vitamin D. Unfortunately, in Alberta, that's no longer an option right now. It used to be, but here patients can't even pay to have it done. So I do use a private lab for those who can do it and who sort of want to pursue that, because obviously the more targeted we can be, the more successful we are. I just had a result that came back this morning. This woman and her husband have both been taking vitamin D for years and years, and a decent dose, and both of them are still in the suboptimal range. So it is tricky to actually give people the right dose without having their blood test, but we do the best that we can here. But it certainly is more customized when we know.
And then when you test vitamin D, there's the lab range. So here in BC, it's 75 to 150. And I know our Americans will have a different measure of unit for that. So I'm thinking of what those units are. What are they? Picomole per liter, maybe? Do you have your sheet there? You want to look? Just so we don't confuse people that aren't using metric. It's 75 to 150 in Canadian values, and then the Americans it's like 30 to 50 in their values, right?
30 to 100 they consider sufficient.
In the American value.
Yeah.
And ours is 75 to 150. So check here. But I know a lot of functional medicine practitioners, our naturopathic physicians at AccuBalance, they have a tighter range that they like. And the logical is there's the lowest amount, and then there's vitality, where the body functions great, right? So we're looking for vitality when we're looking to create fertile bodies and healthy babies. So do you have a tighter range, or if they're in that range, you're like, it's all good, or do you rather see the range a little bit higher? I know a lot of functional medicine practitioners, the Canadian values, the metric, they like it like 125 is like a sweet spot for them.
Yeah. 120 or up is generally what I look for too. And it's based on science. There's papers showing that people do better when their vitamin D is over 120. So again, not complicated to get people's levels up there. So that's what I target. Yeah.
And then again, we're here just chatting for educational purposes. We're not suggesting what you need to do. So you need to see your healthcare provider, and we're talking the units we see. So you need to check to make sure those are the units that whatever lab you're using is measuring. And so with the preconception care, then you found preconception care, there was a benefit to the baby if the mother had some preconception care, and in this case had optimal vitamin D levels.
Yeah. And one of the things though is that, and this is why I sort of really encourage women around preconception care. So this is about preparing your body and yourself for pregnancy, so that your pregnancy, so that you can optimize your outcomes there. Because the highest dose we've actually studied of vitamin D in pregnancy is 4,000 international units. So if you are pregnant already and then you find you have a low vitamin D, 4,000 international units a day isn't necessarily going to be enough to get your levels up. And so now you're faced with a little bit of a balance of like wading into the unknown of taking a higher dose than has actually been studied versus accepting a lower vitamin D level. But if we do this ahead of time, then we can just make sure your levels get up and then you can maintain them throughout pregnancy using whatever dose is needed.
It reminds me of that quote, an ounce of prevention is worth more than a pound of cure. And in Chinese medicine, when we talk about preconception, our expression is nourish the soil before you plant the seed. Yeah. AccuBalance, we say our formula is healthy baby equals healthy egg plus healthy sperm plus healthy uterine environment. And this is all preconception. So the guy's got to do some work too on this, right?
Yes, he does. Yeah, I tell men it's easier for them because it's sort of the 3 months before they conceive is when that sperm that they'll, that will fertilize the egg. It's just those 3 months before that sort of make the biggest difference for them. But, the woman, it's that time, plus it's pregnancy, plus it's breastfeeding. And so, I try and get them on board to play ball.
Again, Rebecca, thanks for tuning in and sharing some of your science and clinical wisdoms. And again, if people are interested in connecting with Dr. Rebecca Genuis, she's out of the Edmonton, Alberta area in Canada, but she has a whole online program, one on PCOS and one on just on health and preconception care as well. So check out her website. And you can check to see who's shared this video. A lot of these health professionals are practicing integrative, so they may practice this way as well. And then if you're in the Vancouver area in British Columbia, then check out the AccuBalance website at accubalance.ca. We'd love to see you and support you on your journey too.
Awesome. Thanks.